At Nationwide Children's, we have over 250 active quality improvement projects, and with multiple people working on each of those projects, that translates into hundreds of physicians, nurses, other clinicians, non-clinicians, and even patient and family members all working to improve quality. We've had a lot of success with our quality improvement projects. We've seen 60% reduction in serious safety events. We've seen a 23% reduction in mortality, which is lower than expected, but more importantly translates into almost 300 fewer deaths over time. And that's the most important thing, that this is impacting individual patients. In addition, we've seen reductions in ventilator-associated pneumonia, unnecessary antibiotic use, serious falls, surgical complications, and we've seen improved care. To build and sustain a strong quality improvement culture, you want to go beyond just leadership. So using high reliability principles to train every member of the organization so that they make a commitment to safety and they understand their critical role to enhancing and ensuring safety. And then creating and cultivating a new additional leaders in safety and quality by providing additional training in quality to clinicians, physicians, nurses, non-clinicians, and others, so that you build a critical mass that can then take that learning even further.